Thank you for being here today on this very important day when we discuss issues pertaining to the safety and health of our children, and welcome to the Windber Research Institute. And for those folks who are coming in, just please, there's some seats up here. We definitely want Dr. Sahorchak to sit up front, so please join us. Thank you. So get comfortable. There's water in the back, and if you need to get up and move about to refresh yourself, please do that. Okay, so again, good morning. My name is Matt Masiello. I have the honor and privilege of serving as director of the Center for Health Promotion and Disease Prevention here at the Windber Research Institute. Over the past several weeks, I and my staff have been called upon by individuals and groups across the Commonwealth and country to offer comment, advice, and support on how to keep our children safe. Today, I ask that we all listen carefully and respectfully to the speakers as well as to each other. My staff, under the guidance of Carla Good, the coordinator of this event today, paid particular attention to the organization of the event. After I offer a few words, Carla will come to the podium to guide us through the agenda. There are two groups that we direct our attention to today: our educators and our legislators. For many, opinions, thoughts, and positions are in a state of flux due to the latest horrible killing of innocent children. We will attempt today to give our legislative and educational colleagues some additional information in order to guide their decisions and activities in these challenging times. We should all appreciate, and I hope our educators are of the same opinion, that they do have the bully pulpit today. We are attempting today to provide them with information on the issues related to violence affecting our children, to allow them to speak to their colleagues, parents, and legislators in a manner that goes beyond school security, but also into the more complete realm of child safety and health. This will not be the last such event taking place here, but one of the several that will assure us here in Cambria and Somerset counties, and hopefully beyond Southwest Pennsylvania, that we have done as much as we possibly can to keep our children safe. We also hope that what we are doing will serve as a model to other communities across the country. And today, as we all could see, if you already are not aware, keep smiling, because we are live streaming this event to the internet. Now, before we proceed, allow me to thank some key folks who joined us in organizing the event. First and foremost, I would like to thank Mr. Frank Janakovitz, Executive Director of the Alternative Community Resource Program here in Southwest Pennsylvania. Frank and his team have been an instrumental resource to Pennsylvania for now several decades, and they are here today to offer us all sound advice on how to keep our children safe. Carla Good, thank you. She served as our organizer for today and is our program manager of community outreach initiatives and is our master's prepared social worker here at the center. She is our in-house expert, one of our in-house experts on both child and adult bullying. It was certainly a team effort here at the center with Diana Schrader, Allison Messina, Sharon Bartow, and Siobhan Holliday serving as support to Carla. A very special thanks to Annalisa, our administrative coordinator, who made it all happen with receiving phone calls and requests from the public throughout these past several weeks, and to Jonathan Weiss for securing and advancing our social media capabilities, and of course Frank Vogley, thank you for making sure the lights are on and the equipment is working. Jill Nadaluk of Nadaluk & Company for coming on board as our social media guru. As I mentioned, we are streaming the event to the YouTube today under www.youtube.com/CHPDP. Under the leadership of Judge Dave Clementic, I thank our WRI Board of Directors. And finally, let me say that in 2008, I had the opportunity to write a piece for the Hospital News of Western Pennsylvania, where in that document I offer the opinion that health is everywhere. An issue I raise in that futuristic literary piece is the critical importance of having a different type of healthcare leader and the reasons why that is critical to advancing our local and national healthcare systems. I would like to think this opinion was confirmed in a very good but complex report entitled U.S. Health in International Perspective. It was developed by the Institute of Medicine and the National Research Council. The report offered a key reason why Americans are in less better health as compared to 17 other countries, and that is medical care is not just health. For the scientists here at WRI, our approach to health is everywhere is how we have been able to effectively move the biomedical, genomic, clinical, and health promotion research taking place in our laboratories and conference rooms here at WRI to the hospitals and clinics and streets of our communities. We are fortunate to have this kind of leader here at WRI, our CEO, Mr. Tom Kurtz. Tom has provided the bench scientists here at WRI, as well as our public health team, the guidance, support, and flexibility to think and to work deliberately in our effort to guide our citizens to better health. Thanks, Tom. And now, let me introduce Carla Good, who will give us a review of the agenda and comment more about our speakers for today. Thank you.
Thank you very much. Well, thank you for that very nice introduction and welcome, Matt. We thank you. It's so nice to see all of you here today. And I think the common thread of why we're here is to talk about the issue of making our schools and communities as safe as possible for children. And so it's nice to see so many of you here knowing that that's really the common theme of why we are here. Working in bullying prevention and school-based social work, I have the opportunity to go into schools across the state. And what I see over and over and over again is that for most children, or many children, school is the safest place that they get to be all day. Their homes might not be that safe. Their neighborhoods might not be that safe. But for children, they know for 7 hours when they're in their school building, they have a roof over their head, the lights are on, they have access to food, they're with peers their own age, and most importantly, they're in the presence of caring adults. And they can't always say that in their home and in their community. And so as we go out throughout today, I urge you to think about that fact and to realize that as adults, as community members, parents, physicians, healthcare providers, educators, human beings, we are morally obligated as the adults to make schools as safe as possible for all children. And so I hope that you'll take that piece away with you today as we move forward on the agenda, because that's really what this is about, right? Okay, so very good. So I'm so honored to present to you this very expert panel on a variety of different topics. So let me tell you a little bit about who we have here today. First, we have Dr. Maciello, and he said he's the director here at the Center for Health Promotion and Disease Prevention. Many of you may know him as a pediatrician in the area. He also serves as the U.S. Network Coordinator for the World Health Organization, Health Promoting Hospital Network. And he has over 15 years experience in bullying and school violence prevention and firearm injuries. And he has developed and implemented a host of evidence-based health promotion initiatives throughout his career, including bullying prevention, health promotion, childhood obesity, injury prevention, coordinated school health, and public health issues in general. So thank you, Dr. Matt. I would also like to say that we are honored to say that in 2012, he was presented with the Pennsylvania Public Health Association Keystone Award for Distinguished Service in Public Health. So we are all quite proud of him for that. Next, we have Kurt Davis. He currently serves as the administrator at ACRP, and he has over 36 years of experience in the public education setting. He was also the Safe and Drug-Free Schools Coordinator and Director of Student Assistance Programs for many years. He has 20 years of local governmental experience. As you know, he was our city manager. And he also was the local consultant to President Clinton's development of the Violent Crime Control and Law Enforcement Act of 1994. So that's pretty impressive. Thank you, Kurt. We also have Jill. Jill is a licensed clinical social worker, and she is the supervisor of school-based mental health counseling program at ACRP. She has a variety of mental health background, including rural emergency medicine research, social work, family preservation, and outpatient mental health as well, just to name a few. So thank you, Jill. We have Mike Buchser here. He is currently the Emergency Planning and Response Management Coordinator for the Center for Safe Schools. He spent 37 years as a police officer in Western PA, and he also teaches recruit classes for the state police. And for the past 10 years, Mike has been teaching a program called Protecting Kids Online through the Center for Safe Schools. And he was the emergency management coordinator for his community for the past 20 years. So Mike brings us a wealth of experience. Many of you may know Mike Bergen. Did I say that right? Bergen? I want to make sure I said that right. He currently serves as the chief of the Richland Township Police Department, and he has worked in the PA State Police region for many years. He was hired in Richland in 1986 and has worked on various programs including Drug Task Force and computer crime. So he brings us another really needed and necessary avenue of information. And then we have Cheryl Bartow. Cheryl is my coworker and friend, and she currently serves as the Director of Bullying Prevention Initiatives here at the center. Her background includes many years in the realm of school-related violence. She was the Director of Education for Victim Services and also a classroom teacher for many years and had more than a decade of experience in bullying and school violence. So she brings us a very nice rounding out of expertise here today. So without further delay, it is my honor to welcome welcome our panelists to the stage. Once we complete the presentations, we will then be moving into a Q&A period, and we anticipate there'll be a lot of robust and interesting conversation developing. Thank you so much.
This may be difficult here, a little dangerous. There we go. Okay. Hi, everyone. We're going to make this, and it is going to be a fairly fast-paced, deliberate series of presentations by myself and our colleagues, because we really want to get to the point of not only giving you the information that each of us would like to present to you today, but also time, and a respectable amount of time for questions and answers. And again, realizing that this is not going to be the first such event. We will be coming back with other very key topics, important and key topics on the issue of child safety. I'm going to give you some data today. It's not necessarily an opinion, but it's data. And again, it's data that hopefully will guide all of us, but especially our educators and healthcare professionals and media who are here today. I had the opportunity to speak at a local Rotary Club session gathering yesterday, and I presented data from this particular report from the Institute of Medicine. It's brand new, right off the press, and it's entitled U.S. Health in International Perspective, Shorter Lives, Poorer Health. And it really comments about where we are regarding our health in this country as compared to 17 other peer countries. And unfortunately, overall, it's not very good. And I'm not going to concentrate, obviously, in trying to present you the entire report, but that information pertinent to the subject of today. For many Americans, for many years, Americans have had a shorter life expectancy than people in almost all of the peer countries. For the past 3 decades, this difference in life expectancy has been growing, especially among women. And you could see that, you could see that the United States is at the bottom of the list, ahead of these 17 other countries, both in the male category and in the female category. And you know, we do okay in this country, and we surpass other countries in life expectancy once we reach 75. So if we reach 75, we're golden in this country as compared to the rest of the countries. But it's in our effort at a younger age where we fall behind the rest of the world. In this particular slide, it comments on where we are with general practitioners as a proportion of total doctors in the community as compared to 15 other peer countries. And this is important because one of the issues that we have in this country is the amount of resources we have at the community level. And in this country, we lack general practitioners to help us in these issues of mental health and in health in general as compared to other countries. So other countries, as compared to the United States, have more of a in-community, on-the-ground type of resource available to them where they've experienced that they have better health with that type of approach. Here we struggle with that in the United States. This slide depicts the level of poverty. A Finnish consultant from Finland, when a consultant on education, when asked his opinion of how he could help bring in his standards and recommendations into the United States, Finland is recognized as having the best educational system in the world, or one of the best. His comment is this: he says, "It's very hard for me to come into the United States and offer opinion about what we do in Finland because of the level of poverty you have in the United States." So it is a factor in both our health and education. This slide is concerning because it comments on the violent mortality among adolescent and young adult males in the United States. The red is the United States. The top curve represents males age 15 to 19. The bottom represents males age 20 to 24. And you could see that our level of violence in this country supersedes to an incredible amount what's happening in the rest of the world as compared to our peer countries. In the report, it goes on to say that because it is a complex situation we have in this country, and more Americans are dying from violence. Firearms, which are highly lethal, are more available in the United States than in peer countries. And they feel this is a factor in our violent-related society that we live in and why it's so much more violent as compared to the rest of the world. Our own Penn State University, interestingly enough, has a firearm injury prevention section in their research, in their world of research, and they came out with a report in 2011. So it's one of the few reports that we have available at a national level that comments on the issue of firearms as it relates to violence and as it relates to children. There are 13 national data systems at separate federal agencies, meaning that these 13 agencies really do not have the ability to communicate with one another on providing the most comprehensive and cohesive singular document on data as it relates to firearms and violence, meaning that we have a fragmented system in our country regarding the documentation of incidents related to firearms. The CDC, at their best, for them, it takes 18 months to collect, verify, and release data. So we're always 2 years behind in getting the best data that's available to us in this country. And we have limited data on firearm manufacture and sales from the U.S. Bureau of Alcohol, Tobacco, Firearms, and Explosives. And for the past few years, we have not had a director of that agency. So again, controversial points potentially, but also points that reflect on our society as it relates to violence in our country. Among the leading causes of deaths from ages 15 to 24, homicide ranks second and suicide ranks third, with the number of firearm-related homicides and suicides outnumbering the next 9 reasons, and I list the 9 reasons. Of the 50 upper and middle income countries with available data, there is an estimated 115,000 firearm deaths annually. 30,000 of those are in the United States. Among industrial countries, the U.S. firearm-related death rate is 2 times that of the next highest country. Overall, when the proportion of households owning firearms in industrial countries decreased, the population of firearm suicides decreased, and in most countries, the level of suicides decreased as well. More U.S. women die from firearm injuries at a high proportion than in most other high-income countries. On the whole, carrying a firearm does not seem to be guaranteed protection. It may, on average, increase overall injury risk. And again, realize that this is the best data available to this particular research institute. Every 17 minutes, someone commits suicide with a firearm. The U.S. is behind most other affluent countries in life expectancy. Firearm deaths account for 27% of the U.S. male mortality when compared to other peer countries. Regarding low-income youth, a quarter have witnessed a murder, 85% witness some form of violence, and 70% report direct victimization. Mothers are 2 times as likely to express symptoms of depression and anxiety if they witness violence. 95% of all guns used in crimes and then recovered and traced have been sold at least once by private parties. Rate of firearm suicide among a cohort of adults who purchased a handgun was 57 times higher in the first week after purchase. That's the first week after purchase. Relative risk to commit suicide is 5 times greater among people living in homes where guns are present compared to people living in homes without a gun. For households with members below 24 years of age, it is 10 times greater. There are some potential areas of agreement. Majority of people polled, and we've been hearing more recently of the various polls that are out there. This particular poll or comment came out of Penn State University. Majority of people polled feel government should do everything to pass to keep handguns out of criminals. And this was a ratio of 70 to 52% of gun versus gun owners or non-gun owners. To raise safety regulations and a limit number of handgun sales to 1 per month, and mandatory regulation of handgun sales. In countries with the most favorable health outcomes, resource investments in infrastructure often reflect a strong societal commitment to the health and welfare of the entire population. And this is the decision that we have to make today in our society. Where do we put, as a society, our health? How important is it as compared to our children in the school system, our right to own a gun, our right not to own a gun and live safely? These are the types of questions that we need to ask, and hopefully our educators and legislators will allow us to do that. When legislators now define or state that they are pro-gun, I think it's incumbent upon them to explain that. And not to say, and I don't in any way offer this as a negative statement, but we need, as community members, as healthcare workers, as legislators, as educators, to really hear what, and for them to interpret based on sound advice and hopefully nonpartisan decisions, what they mean when they state this information. And I'm not sure if you could all see this here, but this is a pyramid that we've developed here that I think is, that we feel is the basis of how we should approach this issue of school safety. At the bottom is the all-important issue of community-based youth risk survey data. We need good data to react to, both in our communities as well at the national level. The next level up is local and national teacher excellence. And there was a bit of controversy in our group about what do we mean by that? And it really means just that. If we are able to produce and embed our best teachers in our school systems the way other countries have been able to do, we are going to be able to have a class of educators that will be able to interact, more closely with professionals in the community, as well as do their best job in teaching. The next level up, school-based mental health teams, self-explanatory, safety and health resource coordinator. Potentially we need to redefine what we now commonly identify as a safety or resource officer. You know, there are limited funds available to us. We need someone in the building that provides that school administrator, yes, with safety and security, but also with who could lead the charge in dealing with other health issues related to children, whether that's the same person or a different person. School security and entrance policies, obviously very important, but not the only issue. As I've traveled the region, oftentimes I've been in schools where initially the conversation is how can we have the best camera, what's the best camera, what's the best way to secure our doors? And finally the conversation goes beyond that into the issues of health and school safety and bullying and mental health issues as it relates to our children. We need evidence-based bullying prevention and violence prevention programs in our schools. If we're saying we have an epidemic of something, whether it's an infectious disease or bullying, then we need to provide our best programs at a national level to address the issue. Right now, that process in this country is very fragmented. We have dozens and dozens upon violence prevention and bullying prevention programs, and we have to find some way in this country, in our state, to make it more comprehensive, to allow us simply to evaluate what we do. If we have more programs running through our schools, it becomes very difficult in any given community to determine how we're doing in that school. And at the top of the list, but not necessarily the most important, really, is firearm legislation and education. So I'm going to stop there. If you could hold your questions right now and let the rest of the speakers come up, so we'll have some nice, invigorating questions for our panel discussion. That will be nice. Thank you. Okay.
Thank you.
No clicker. There you go.
Thank you. First of all, I'd like to say this. I got to be honest. I look at the audience and I'm a bit humbled because I look and I see people that I've worked with in education that started me out, in caring about these kind of things. I have to tell you, one of my earliest experiences was in resiliency training with Dr. Zahorchak. I'm a true believer in it. School resource officers we put in place. I've worked with law enforcement. I've worked with guys like Ron Springer in emergency management, local officials. I'm looking, I see education, I see law enforcement, I see elected officials. I think it's awesome. And when I was asked to participate, I thought, okay, so what do I bring to the table? And to me, what this is all about is simply getting us here as a conduit, because probably the best ideas, Dr. Maciel did a great job on statistics, are some ideas that some of you people have, and can we keep that going, that then those ideas, you know, turn into a conversation so that the awareness level goes up, the cooperation goes up between all of the different groups that we have here today. Now, one of the things that I want to talk about very quickly is you saw on Dr. Maciello, school-based mental health. With ACRP, I was fortunate enough to, I've always been fortunate enough to go into occupations I enjoy. Maybe it's my selection process. But what's nice about it is behavioral health organizations, there are others out there. And the caring people that are there, we work with about 5,000 kids over a 6-county area providing services. And we are in every school district in Cambria County. We're even over in Somerset County providing school-based mental health services, which is why my cohort Jill is here, because she's one of those people that is a frontline person in the school. So a lot of people may not have a good idea on what school-based mental health is. I'm going to give you a quick run through and then talk about a couple other issues. All right, school-based mental health. All right, we're going to get this thing working now or not? There you go. All right, here's what the research tells us. All right, I'm not going to spend a lot of time on this data because Dr. Maciello did it, but I think we all know about 70%. Look, 1 in 5 youth have a mental health condition in the United States today. 70% of those get no treatment. School, and every school administrator knows here, unfortunately, guess what? Portal to portal, they're your responsibility. And you are the de facto parent, and as such, that's a lot of responsibility that I know you don't take lightly. And in my 36 years, I didn't take it lightly either. Because of that, we have to take a serious look at it. And 20% of youth have emotional behavioral. 16 and 33 receive any services. 23 of Illinois and 34% of Chicago adolescents exhibit signs of depression. These are just some data that we don't necessarily have to go over because we talked about it. Now, where to access mental health services, okay? Now, we can go to, for years, and when I was running student assistance programs in the Greater Johnstown School District, and we would identify a youth, and they'd come in, they'd do an assessment, say, wow, this child has an issue. They need some therapy. And then what we would do is we'd say, okay, let's schedule a therapist. And they'd look at us and go, okay, we can get them in 2 months from now. And my face used to go, are you kidding me? You're telling me a kid needs services and you're going to see him 2 months from now? Then, I know everybody out here has had those kind of experiences where you look and go, wow, this isn't right. And that's where this kind of grew up. So what we did was we started saying, okay, how can we address this issue? So we actually went to the county commissioners at that time. And what they did was they turned around and said, all right, let's create another avenue. We all know that you have to go back. I always tell people to go back and think about it. And I have some students in here who, are now superintendents. And I always say, let's go back and think what we were like in junior high school and high school, because that's the perspective we sometimes lose. Sometimes those issues, I could have used a little help back in 7th and 8th grade, but sometimes those issues are more age-related. So what we did was we created another scenario. We created a pathway for students that needed serious help, and we created a pathway for students that it was probably more an adolescence issue. They only 2 or 3 sessions might handle it, so it wouldn't clog it up. Now, we've gone beyond that and gone to school-based mental health, because now they're in school. They don't have to take a full day off, a half day off. You love to go, come on, you have a doctor's appointment when you were in 8th, 9th, 10th grade. right? How long did you take off school to go to the doctor's appointment? Oh, Ed and I know, at least a half a day, you know? But here we are, we're in school where all of a sudden that kid can walk in, and we even alternate what class they miss, what day of the week it is. You know, it's that kind of flexibility that provides those kind of services to the students. Plus, they're more comfortable, you know what I mean, in that school environment. So it's a more natural environment. It's easier to collaborate with the school. It's less costly. So these are the kind of things we need to think about for school-based mental health. All right, this is Center for Health and Healthcare in Schools. We may be several steps away from making this vision a reality, but education health professionals are increasingly aware of research demonstrating behavioral and emotional health contributes to effective learning and academic achievement. And an increasing number of community students have access at school for help with mental health problems through mental health assessments, crisis intervention, early intervention, and treatment, George Washington University. Now, I'm also currently a lead facilitator for the state of Pennsylvania for school-wide positive behavior and intervention support systems. And when they asked me to participate, and I went to the first meeting and said, all right, what's it all about? And somebody explained to me that if you create a safe and comfortable culture in a school building, it will increase academics and decrease behavior issues. And we're being live streamed, so I won't say what I said to him, but I looked at him and said, really? It took this long for you to figure that out? Good people doing that all their careers. But what's nice about it is the University of Oregon put a framework together, and it includes everything from government officials to law enforcement officials to school administrators. So that's what's nice about it. So I did buy into it, you know, and that's one of the other things we're working with. Where do we get our referrals? We get them from parents. And you all know, that's crucial. And one of the other things I'll tell you here, in talking about this and having spent 36 years in education, and you people that are in education, think about this. How tough is it sometimes to create that cooperative feeling between the school district and the parent, rather than an us and them? You know, we're in this together, guys. This is a cooperative effort. This is a team effort. We both want to do what's best for this child. And I have to tell you, when I was getting over 200 referrals a year just at the high school. And the state put in a mandate that you had to have this parent sign off on it. We were getting a 95% sign-off rate from the parents. But you know why? It's because we told the parents, we're not going to undermine you. We want to work with your child to make it a better home and school situation, and we are going to work with you, not against you. And you're going to have to trust us to an extent. We will share information. We will do everything we can to get your son or daughter to share that information. But sometimes you're just going to have to take a level of trust here. And we were very successful in it. But it's that communication, you know what I mean? And parents are vital. Your SAP teams. You know, I have to tell you, whenever we had a student assistance program, and every school district has it. And I don't know where some of you administrators are, but I think if you have a good, active student assistance team, that's a good referral source, all right? Other school personnel, guidance, principals, administrators, other agencies. We work with the juvenile court, we work with the county mental health, and we work with social service agencies. So we get a number of referrals from a lot of different areas, all right? How are schools and agencies the same? Both want to help the child. Both need parental permission. Both must adhere to HIPAA, and we have to. Both must adhere to FERPA, which is, you know, the Federal Employment for Privacy Right Act of Students. Both utilize a problem-solving approach, focus on removing barriers to support social and academic achievement. Both must be sensitive to needs and interests of our clients. Both want to help the child. And by the way, I'm running through this quickly. If anybody wants this, I'm a free domain person. I'll send the PowerPoint to you. Just contact me and I'll send it to you. Now, here's one of the interesting things. What's it all boil down to? Dollars and cents. And I know I just talked to, Mr. Huffman here from Windber, and I know some of your other superintendents have already seen this, but the biggest thing is how are you going to pay for these services? Well, what's nice about it is if you have a school-based mental health program, then it saves the school district money. And I know we've had very successful with the Greater Johnstown School District because what's happening is we turn around, we have a business plan. And what that means is, as an agency, we're already talking to the insurers. So we know. Now, once we talk to the insurers, we also have these things. We can tell when they walk in, is it an eligible service to be paid for? Is it an eligible client? Are we eligible providers? If we're going to go with Medicaid, we have a certain therapist we use. If we're going to go to a third party, be it Blue Cross Blue Shield or some third party, we have to have a different level therapist. We know that. And then all of a sudden, we become an advocate because we're doing the billing process. So that's kind of nice. We're not the only one offering this, but this is what's nice about agencies coming into schools and helping the school district out. Because if not, guess what? Your business manager has to be out there fighting for you. And in this case, you don't need that because as an agency, we will work with that, all right? So, and I kind of like this as we're, now look, and the cat disappears. I stole that from somebody. That was a great one, though. But if you look at it, you say, okay, what are we talking about here? You know, would you please tell me which way I ought to go from here? That depends a good deal on where you want to go, said the cat. I don't care much where. Well, then it doesn't matter which way you go. And that's kind of where we are, right? One of the things that I hope comes out of here is we get a feel as to where do we want to go. And then at that point, let's continue this conversation to move forward. And where do we want to go? What are our goals? How do we want to get there? Who has to be involved? What are the costs of our actions? But I think even more importantly, what are the costs of our inactions to our children and to our society? So that's kind of where I'm coming from. And like I said, and Dr. Masiello said, I know Jill wants to say a few words. She's going to do the close-up on it. But any questions you have for me or for Jill, fine. Let's continue the conversation. And thanks for coming here. And I hope we look forward to working with all of you in the future, right? Thank you. Jill, you're up.
Hello. Kurt does a great job of defining our mission and what we are all here to do today. Thanks. I just want to give you 5 areas to consider when planning for the prevention. Number 1, knowledge. Knowledge and awareness of the mental health and emotional health issues. 2, identification of the problems. Identification of the students who are in need of help. You know, that's a biggie. Number 3, everyone getting involved to create the safe environment. You know, more parental involvement, the community, school staff, individuals. 4, knowing the warning signs. Being able to recognize behavior changes in the students, in people that are working in the schools. You know, listen, observe, ask questions. Discuss with children, because we all do have the duty to warn and protect, each one of us. And 5, you know your resources and supports available to you and to your schools and in the community. The team approach is the most effective tool that we do have for prevention. So, you know, that's together we can do it. And that's just, you know, summing up everything that Kurt had to say, but that's all I have. Thanks.
Good morning. We'll get that going here. I'm going to talk to you about the preparedness side, or the law enforcement side, or the fire department side, or the emergency medical services side, something that we don't normally talk about. In your building, wherever you are, how are the people going to respond in the first few minutes if something does happen? Have you ever thought about that? And then how are they going to respond a couple hours later? Because if you're into a big event, it's going to take hours, days, or weeks to go through that whole. Do your people know what to do? In your place of business, do they understand what they're supposed to do? 10 safety tips for handling school calls. Nooks and crannies all over the school. If I talk to the school resource officer, if I talk to the shop teacher, if I talk to the athletic director, they're going to be able to tell you where the next fight's going to occur in the school because they pay attention to that sort of stuff. Now, do teachers also know that, and hopefully do the principals know that, but do we spend our time thinking about those are the places that we should be paying attention to? Don't assume that the kids, the teachers, those people who are going to come into your school are going to be compliant and respect your rules, your regulations, and what is going on. Watch the group dynamics. I don't want to use the term gangs, but I will. And whether they're actual gangs or just a bunch of people who hang together that have the same ideas, they're going to be moving like the flash mob whenever something happens. Resist tactical complacency. I'll bet if I ask the police officers who are in the audience whether when they came into the building they were looking at where the doors were, where the windows were, where the escape routes were, what are they going to do if something happens, more of them will have already prepared for something to happen in this room. We all have to be thinking in our schools, in our cafeterias, in our offices, where is that threat going to come from and what are we going to do if something does occur? Don't assume that the students are unarmed. We try to, throughout our whole life, make excuses for why people are acting the way they are. We have to, in order to make sure that tomorrow is safer than today, is not assume that everybody's going to be a nice guy. We have to be looking at them and look for those clues or cues that are going to give us to say there's a problem here. Be prepared to deal with the confrontational attitudes. Most people on a SAP team are ready for that. Solicit help from staff and students whenever the emergency occurs. How many volunteer firefighters do we have that are on staff that would be able to respond in an emergency? How many of the kids in the school are beginner volunteer firefighters? How many are Boy Scouts? How many are members of organizations where they've been taught first aid, they've been taught CPR, and they are on their way to a career or a volunteer time whenever they're going to be helping their communities? We need those in the schools because perhaps we're not going to have the police and the fire response necessary that we think that we're going to have. Stay alert for the drug use and watch the parents. Remember, the kids didn't become this way because they learned it just on TV. We have a problem with our parents, which then brings the kids into the school with the problem. Pennsylvania, nationally, we rank #1 in incidents of school violence on a per student basis. We're the worst. Now, there's a reason for that, and that's because our PDE collects data and has for so long. We have a little bit more reporting than other states and other large school districts around the country. We have 2.7 school bus accidents that occur in Pennsylvania every day. That means our school buses, either somebody is being taken to the hospital from an automobile accident, or the bus has to be towed, or the car that hits the bus has to be towed, or the truck that hits the bus has to be towed. 2.5 reportable hazardous material incidents occur each day in Pennsylvania. How close are they to the schools? And do our plans have the hazardous materials planning in them? There are more than 450 tornadoes were confirmed in Pennsylvania since 1985. Let's talk about weather emergencies. PEMA will be doing the annual drills next year that we're supposed to participate in. 450 tornadoes. If a tornado comes through any one of your towns and just stays on the ground for 1 mile, after that's over, where are our police, fire, and EMS? Are they going to be coming to your school, or are they going to be somewhere else, or are they going to be spread out over the entire area? It's not all about guns. We have problems in our schools that go far beyond just the gun problem. Top 5 reasons schools fail during an emergency. Failure to develop an all hazards plan. That's worrying about the guns. But it's also worrying about the severe weather. It's worrying about the tornadoes. It's worrying about the high water. It's worried about the interstate highway that has a tanker that's going down and wrecks into another tanker, and we have 16,000 gallons of methylethyl death that's going through the air toward our heating, air conditioning, and ventilation units. Failure to disseminate the plan. That means that administration has the emergency plan. It's all hazards, but we don't give it to our teachers. We don't give it to our principals. We don't give it to our custodial staff. We surely don't want to talk to the police department, the fire department, or EMS about that. We don't want to talk to our emergency management agency. We don't exercise the plan. We don't know what it's going to be like whenever our fire company comes in and throws the ladders up against the side of the building. We don't know what it's like whenever the police department comes in. We don't know what their needs are or how they're going to provide services to us. If we do have an active shooter, what's that police officer going to do when he comes into the building? I'm laying there bleeding. Is he going to provide me help? No, he's going to step over you. And he's going to be going on his way to catch the bad guy. And if you ever saw a police officer not stop to render aid, you'll be shocked then, and perhaps you'll need the mental health after that. Failure to update the plan. We built a new dam, we put in a new road, we put in a new culvert, we changed the size of the culvert. All those things that change every year that could change what problem we have in our buildings. And the number one failure, the top reason, is that we just think it's not going to happen here. We have our heads stuck in the sand and we say it's not going to happen here. That happens in the big cities. That happens in the those towns where they have problems with gangs. It's not going to happen in our time. Emergencies will be different, but they're all going to be similar. This is the New Orleans School District during Katrina. They didn't use their buses to get the people out of New Orleans. They just left them sit there and be flooded and destroy all the value of those school buses because they didn't have a plan if something like that happened. The further you are away from your last emergency, the closer you are to the next. Just be prepared. It's going to happen. If you don't spend the time beforehand preparing, you certainly will spend the time in recovery afterwards. These are the legal requirements why you're supposed to be doing the planning. The Safe Schools Act, Chapter 10 of 22 PA Code, the Pennsylvania Emergency Management Act, Title 35, and No Child Left Behind. There's more than enough laws and regulations out there that say we're supposed to be doing this. And yes, we're schools, and yes, we're educating kids, but we're also supposed to be taking care of their safety. These are our societal requirements. Some of you remember getting under the desks at school because during the Cold War, we had to prepare for that nuclear attack. And a lot of people made fun of getting under the desk because if a nuclear attack occurred, what would getting under a desk do for us? But the fact of the matter is, there are people today alive in Hiroshima, Japan, who were within 4 miles of the bomb. But getting under the desk keeps you from the roof hitting your head, and you're prepared. We want to do that same thing with our storms, our severe weather drills. Getting under the desk keeps that roof that is caving in from hitting us. Everybody remembers Middletown and 3 Mile Island and the scare we went through there, but do we remember Japan? Do we remember Russia? When the tsunami hit the nuclear plant in Japan, all 7 of our sensors in Pennsylvania went off because we were taking radiation from what was going on in Japan. Did we pay attention to that? Do we know that Middletown got more nuclear radiation from Chernobyl than it did from 3 Mile Island? And do we pay attention to that? We can't get tactically complacent. Littleton, Colorado, everybody remembers that. That was a watershed moment. The most children we had die in a school attack up to that date. Beslan, Russia was another watershed. That was whenever school attacks became political. Bart Township, Pennsylvania, that was another watershed. That was the first time we had people who weren't associated with the school attack it. And if you don't know where Bart Township is, that's the one-room schoolhouse. And the guy who did that attack had nothing to do with that school at all. Most attacks do. Newtown, Connecticut, most recent, took over from Columbine with the most deaths. But again, it was somebody associated with the school. President Eisenhower said plans are worthless, but planning is everything. The plan itself, once the emergency starts, the plan is going to be outdated. But the fact that we plan to get there is going to make us better able to respond whenever the event does occur. Whenever we realize that emergency means that it isn't going to happen the same way every time, we will be better prepared. Good emergency plan developed by a multidisciplinary team. We have the police, we have the fire, we have the EMS, we have our school psychologist in there, we have our SAP team, we have our guidance counselors, we have the emergency management agency, everybody who can tell us how we're going to handle those things. It's got to be a fluid document. We've got to change, not only annually whenever we're required by law to change that plan, but whenever we see that something else has to be changed, we're going to change it. Review and update it annually with those people who are going to help us in the plan, telling us, yes, we agree with that. Yes, we should be doing that. Multi-agency input, bring them in, and test it regularly to conduct drills and exercises. The fire drill is once a month. That's 12 times a year we do a fire drill, whether our students are there or whether our students aren't there. We have to do the bus drills, and how many of our kids who ride a bus do those 2 bus drills every year? And do we do our severe weather drill in March? And look at that drills. And then whenever you get into the active shooter drills, how many times have we done that? Homeland Security Presidential Directive 5 in 2004 is what made the National Incident Management System the base for how we're going to do things. Governor Rendell then put in a proclamation in December 2004, and it requires that the incident command system be used for the way we handle our problems. For those of you who are in the military, it's real easy. NIMS starts out, and we have 5 privates that work for a sergeant, 5 sergeants that work for a lieutenant, 5 lieutenants who work for a captain, 5 captains who work for a colonel, and it does that. It's hard for a superintendent or a principal to understand that they shouldn't take their chain of command and go wider than 5 to 7 people because we're in charge of the entire business. It's hard to understand that. The ICS pulls everybody together, whether it's the fire, police, EMS, the school, parents, the media, and everything pulls us in there. What are we going to do? If you were paying attention to the news media with the thing that was going on down in Alabama, the news media fessed up after it was done that they were standing right beside, their staging area was right beside where the police were doing their drills to go into that bunker. The media didn't tell anybody, although they would have had a story out of this world, that they were watching those police officers prepare. They didn't, because they knew that it had something to do with the safety of the child that was in that bunker. And we have to all cooperate like that. I'm talking about the tactics. We have to talk about the kids, though, too. And we have to remember that kids that are in elementary school respond to that trauma differently than the kids in middle school, differently than the kids in high school. Depending on what their background is and what they have seen in life, it's going to affect them differently. That's why we need all those people who understand the psychology of it as part of our team whenever we're talking about our multidiscipline team. One of the common responses whenever an emergency occurs is that there is a loss of trust, not only from the kids but from the parents and the community. They lose trust in their school, they lose trust in their administrations, they lose trust in their police departments, they lose trust in their fire departments because why didn't somebody tell us that this could happen? Why didn't somebody prepare us for what we were going to go through? Understand that whenever the police officers come into your building, their first thing they're going to do is life safety. And is it your life safety? Yes. But it really starts with their life safety, and they're going to be coming in and they're looking for the bad guy. They're going to make you safe by putting you in the background. They're going to take the lead. They're going to be in front. They're going to take the shot. But with that, then they're going to have to keep themselves safe. They'll then, after being concerned about life safety, they'll try to stabilize the incident. How do they stabilize the incident? They kill the person who is causing you a problem. Understand that. That's what the police mind is looking for. And whenever you're talking to your policeman, understand that that's what's going on. They're then going to be there to protect the property. They're not going in, even the fire department is not concerned about your property, they're concerned about the life that is in that property. And then, if you have those two tankers of different kind of chemicals that are leaking the chemicals near your school, they're not going to be concerned about keeping that out of the river or out of the lake. They're not worried about the environment, they're worried about the life right now. So don't get excited if they don't start putting their barricades up to keep that methylethyl death from rolling into the lake. Just because it hasn't happened here doesn't mean it never will. If you do your planning and if you do your preparedness, you're going to have a better outcome, regardless of how you handle it. I'll take questions later.
Good morning. My name is Mike Bergen, as I said, with the Richland Police Department. A little history of active shooters. We tend to classify these as active shooters. Goes back as far as what mass media covers. Active shooters have been around for many, many years. But probably the most publicized one prior to the expansion of them in the 90s was the University of Texas. Charles Whitman shot 14 people, killed 14 people from the tower in Austin, Texas. Bring it back into more recent times with us, we had Columbine, 2 shooters, multiple victims of Columbines, Nickel Mine School here in Pennsylvania, Virginia Tech. Nickel Mines, Virginia Tech was sort of a paradigm shift for us in how we responded and how we have to respond to these. Starting with Nickel Mines and then in Virginia Tech for law enforcement, we found that the active shooters were barricading the doors, blocking the doors to try to prohibit first responders from going in. Unfortunately, a lot of our tactics we use, people publicize them, books are written, things are published on the internet. If you think these active shooters and you take them for granted, they study what they're going to do. They plan, they prepare, they'll have layouts, they know what they're going to do, and they try to counter some of our things. We saw that in Virginia Tech, we saw that in Nickel Mine School. Chardon most recently this year, and lastly the Sandy Hook School, where the mass shooting occurred. Closest to us here was in Nickel Mine School, but I'm here to tell you one thing. Everybody seems to think, gets the idea or the mentality it's not going to happen here. On September 13th, 2013, that was thrown out the window for me when we had an active shooter at our police station. He decided to show up, we had dealt with him, and like these previous incidents, he had some mental health issues, and showed up, luckily just damaged one of our vehicles before he was confronted by officers and shot. We got lucky. We got very lucky. I can't talk a lot about the circumstances, they're still court related to that, but For me, I was happy he came to our station. Sounds kind of funny. Why am I happy? Because if you know where my police station is, it is surrounded by an elementary school, a high school, a community college, and a university. Had he chosen one of those over us, the outcome might have been different. He was able to obtain firearms. These are active shooters, so we can't kid ourselves. They're called an active shooter for a reason. They have a firearm. Some things about active shooters. They're not impulsive. They've planned. They've studied. They know what they're going to do. They've trained. They know how to use their equipment. Klebold and Harris had videos of themselves training as to what they were going to, training on the firing ranges, shooting different things. Not targets like we would think of, but instinctive type shooting. Virginia Tech shooter. People at the range said he was practicing how to reload, how to shoot and move and shoot. All tactics that we do. They begin to assert themselves like with a commando type of thought process. But they have that interest in practicing. A lot that we've seen in the incidents I had suffer from some type of mental health. Our suspect in our shooting at our school we had dealt with him a couple weeks prior, and there was a slight disconnect. We were there for a mental health issue. He was living with his mother. We couldn't get him committed. They had some agreements that they signed with him. Unfortunately, he decided then within a couple weeks to vent his frustration out in his active shooting role. We need to start working together in an effort with everybody. School collaboration is probably the most important thing. We as law enforcement have to work with our school officials and vice versa. We can't have a cookie cutter plan out there that says, here's a checklist, I can give it to the Johnstown School District, it's going to fit Richland, it's going to fit Windber, because each area is unique and different. Johnstown has resources with their police department we don't have. Vice versa, with paint. Every place is different. You have to adjust your responses and your safety plans to what your area is like. But when you develop these plans, include your police department. They will have good input. I remember in the late 90s with Johnstown School District, a large full-scale plan was enacted where we tried every service from EMS, medical, flight, other police departments, SWAT team. Everybody had a stake in it. Very long process. It took, Kurt, was it close to a year to bring everybody together for that. That was a large full scale. We're not saying everything has to be at that level. But if you have plans, plans are no good if people don't train with the plans. If the day of the shooting is the worst time to find out, I have a plan, and you hand it to the police department to try to figure out where they're going in your school, what they're doing in your school. The time that we joke, the time that the bullets are flying is not the time to sit here and think about what we need to do. It's time that we react. And you're going to find law enforcement officers in our training we do, especially some of the SWAT team members, it is reaction. That's why you hear people say, why do police, why do fire, why do they always run to to danger? That is our reaction. That is how we're taught to react. I've heard before you talked about physical security being one part of it, and it is only one part of it. Putting there's a big debate right now about putting armed police in the school. I tend to like it, but it is not the solve-all problem for everything. It is one piece in the entire puzzle. You've got to look at that, your physical security. And for one thing, I'm glad to hear, we talk about mental health within the school. Those incidents I told you before, what was the common factor? Mental health issues. Either undressed, there was no avenue for them to go, or the system had thrown them out. So when we start looking at monies, and I know there's legislation around, everybody gets on one side of the debate or the other side of the debate, we need to look at that factor of getting something for prevention. We, as law enforcement officers, we have to go by our resources. Unfortunately, a lot of times, because the resources dwindle in law enforcement, we become reactive. I'm a person who believes in proactive policing. But to do proactive policing, you need more manpower. The reason I say that is if you get to a level where all you can do is answer your calls, you're not stopping crime. Being proactive in law enforcement means we're going out and we're going to stop the crime before it occurs. And that is what the proactive thing can do. And being proactive with mental health issues within a school, having a school resource officer in a school who can know those people, knows the kids. We've used Chad Miller from the Johnstown School District with some of our cases we've had. He knows the kids in the school. He knows how they're going to react. So he's one piece in their entire puzzle. But we can be proactive and try to prevent a shooting before it occurs. We never like to respond. We would rather stop it before it happens and anybody gets hurt. With that, I'll take questions afterwards, and I'll turn it over to Cheryl.
Wow, I guess I would like to echo Mr. Davis's sentiments that I'm humbled to see all of you here and to have had the pleasure to work with a lot of you over the last 12 years in Cambria and Somerset County, and it's not lost on me, I guess, my spot on the agenda, so I will be brief, but I think that there are many factors that affect the mental health and well-being of students daily. Many of those are external factors: family situation, neighborhood environment, drug and alcohol abuse, the state of affairs in the world, you know, access to violent video games, media, all the negatives that you hear about daily. But coming from the educational background and spending time as a teacher, I think that I would like to bring it back around to the factors that are internal in education. And teachers, for me, are a huge part of this solution to this. And I think that when you look at the internal factors and the ways that students and staff, not just teachers, but primarily teachers, interact with one another daily, and more importantly, perhaps the way they react and support one another in the face of, you know, large crisis like Sandy Hook, or even individual crises, bullying, for example, it really defines for each student what their school day is going to be like. And so, most of you know we have a long and storied history with all kinds of school safety, especially bullying prevention here at the center. And I will start there with the bullying and mental health tie-in. And there's been a lot of attention to this connection, perhaps mistakenly over the past year or 2 years, especially in Pennsylvania over the last 15 months. We've had more than our fair share of children who've harmed themselves because of this. But really, there is no direct causal link in the research that correlates bullying and suicide or even homicidality. More importantly, there is a link between bullying and anxiety and depression. And so the essence really of this slide, the mental health tie-in, is that the more the children are exposed or involved in bullying, whether as target or as aggressor, or even, I would say, other antisocial behaviors, the higher the likelihood that they will experience mental health disorders, primarily anxiety and depression. And what really sticks with me about the research is that even infrequent exposure to this behavior, less than 3 times a month, can yield a 2 or 3 times more severe reaction for these kids than children who are never exposed. So I would ask you, as student serving professionals, when is it that you start to pay attention to the issues of pro-social, getting along, or relationships between your students? When does that happen? 2 times a month, 3 times a month for a student? It's really important to note that this behavior doesn't have to happen often to have an effect. We could probably spend a lot of time here. I know my colleagues are probably like, Cheryl, don't talk for hours about this issue, but to just hit the highlights, I think it's important to note that there's reason to be hopeful about it. Data shows us that most children have sympathy and empathy for kids who are going through this, but you know, over half of them only try once or maybe never try to help a student. And what does that mean for us? Well, it's incumbent on the adults, as Carla said earlier, to take meaningful and active stance in giving these students the knowledge and skills to act on the feelings that they naturally have. Too many times, perhaps, we don't vocalize our feelings about these things. We're worried about making adequate yearly progress and you know, keeping parents happy so they're not beating down our doors on a daily basis. But do we ever stop to show kids that the way that they get along with one another matters to us. I think simple things like that are easier to get your mind around as a teacher than, sorry guys, where's the detailed emergency response plan and where do I go on this given day to practice that. If you just stop and try to think about ways that you can make your classroom, things that are in your control as a teacher, safer so that kids feel safe and happy there, are easily grasped, I think, by educators. And all of us in support of educators should try to reinforce those messages along with the big perspectives that we've seen here. A few recommendations, and again, to be brief about this, programs for early identification, referral, and monitoring of students and staff at risk are key, and we've heard a lot of eloquent speaking about that today, so I'm not going to spend a lot of time on that. Research-based pro-social efforts that are aimed at building relationships for prevention, but these also, in a backdoor kind of way, speak to intervention and even postvention sometimes. And you know, I think that many schools are overwhelmed with programming, and we offer a lot of programs to schools. However, concentrating on efforts, I think can be easier. You should meet schools where they are. If they're not in a situation financially or you know, organizationally to implement a full-scale program, there are definitely things that you can do every day to meet your accountability, not only to legislation, but your moral accountability for students. Distributed leadership, I think, is something that we speak of in educational circles to talk about strategic planning and having effective academics for students, but really, have you ever thought about it in a school safety sense? You know, emergency preparedness colleagues, you guys have sort of a role of succession, so that if during a critical moment, one of the leaders of that plan is not there, unable to respond, somebody else knows what to do. Is that true of your school safety planning? Oftentimes what we see in our work across Pennsylvania and into other states is that the pro-social efforts of a school rest with the administrator. And if they leave, if they move, if they travel to another school and someone new takes over, their priorities may not be the same. And all the effort and all the time and money that have been spent up until that point on bullying prevention, school safety, pro-social and character education are often lost. So it was interesting. We had a safety meeting earlier this week in Harrisburg with some urban school leaders from Pennsylvania. And one of the school planning folks that was there from the Erie School District said, "I'd rather have strong teachers and staff than a strong administrator." And I had to think about that for a while because, you know, I've been working with schools for a long time, and I don't know that that's necessarily completely true, but I know that it takes a strong administrator, the efforts of an administrator to place this on the agenda and to keep it strong for staff. And so I think that for me, a staff-driven initiative with adequate support from administration is the best way to go. I want to point out just for a second that there's a really great tool for all of you to use in Pennsylvania that was created by the Center for Safe Schools and by the folks here at the Windber Research Institute, along with some other partners, called the Pennsylvania Bullying Prevention Toolkit, resources for parents, educators, and professionals who serve children, youth, and families in Pennsylvania. There are a great many things in here to avail yourselves of, but one of the more important things is a listing of state agencies who all have local connections that can help you with specific student issues as far as mental health, LGBTQ, drug and alcohol abuse. And oftentimes we have so many resources right at our fingertips, but we don't always call them in when we need them. So this lives online. You can also get hard copies of it. If you contact one of us here at the center, we can ask our colleagues in Harrisburg to get us some. And it was sponsored by the Highmark Foundation. So really good tool to use and build on. I guess, again, by proxy of my spot here on the agenda, I would take a moment to suggest that none of our stances or perspectives is going to solve the problem, but to work toward a synergy between all of these factors is the best way to handle school safety. And it's only our willingness to accept what the other folks are saying and to bring that into our own approach or plan that we're going to do the best for our kids every day. And with that, I guess we can open it up for questions of the panel. I think we still have the portable microphone, right?
Okay, let's get right into the questions. Hopefully there are many. Beware of people in the audience. There are folks out there who I know that sit in the world of politics, education, media. I may refer to some of you out in the audience as well as our panelists to try to answer some of our questions. Okay, anybody have that first question? Let's start from the back. Yes, ma'am.
I was curious. I'm finishing my doctorate in counseling psychology, working on my dissertation. Why did they let that go for 5 days, that situation? Why did they titrate the weight of the boy, the weight of the man, put something down to sedate the boy, and enough that it would not harm the boy and get the man out the first day?
Okay, we're talking about the isolated incident, recent incident regarding second-guessing the people on the scene. So maybe Mike, one of the mics, please.
One of the things that law enforcement is going to do when confronted with that is to sit there and try to look at that implementation. That guy was implementing his plan. Nobody knew what it was. So the police job is to try to back him off that implementation in order to save the child's life. That's why they gave that time. The reason that they then took action was because they had put in the cameras, they were watching what was going on, and he started to carry a gun around. That's going up that ladder from grievance to implementation, and they were then concerned that he was going to go over that edge. That's when they had to take an action. They go to the door to deliver stuff to him, and that's whenever he opens the door, then they have the access. He opens the door, they throw their flashbang, and then they kill him, because that's their only alternative. They can't sit there and talk to him. He has already taken it to the point that that is what the response is. But they don't want to put the child in danger. If they would have gone in on the first day, on the second day, on the third day, or 2 hours before that, they would have put the child in more jeopardy than carrying out their plan. Because carrying out the plan is what's going to get you a successful conclusion, hopefully.
You know, maybe right or wrong, I tend to have some level of empathy for these shooters, because we know in further evaluation of these situations, they are victims, potentially and to a degree, of our fragmented mental health system. So yes, they are the criminals, and yes, they potentially die as a result of these issues, but it's a mental health issue. I'd be particularly interested in hearing from some of our educators regarding a question on mental health and education. Anybody, any of our educators want to prompt the panel with a question? In the back. Yes, ma'am. The front is losing ground over here. We have folks from the back, so beware,
Okay,
front-seated folks.
My question is not referring to your subject, but to Jill. What is your number 2 point in your presentation? I didn't get to write that down. I have knowledge and learning, and 2, I have blank. Thank you.
The identification of the problem, sure, no problem, and also identifying the student and making the appropriate referrals. Okay.
Please introduce yourself.
I'm Ron Springer. I'm Director for Cambria County Emergency Management.
There you go, Ron. Thank you.
My question is, we've heard a lot about guns in the schools, whether law enforcement, school resource officers. Maybe we can debate that for obviously a long time and get nowhere at this point, I think. My question is locally, have any of the schools questioned, whether it be their student activity councils or a grouping of their students, as to what they think should be done in the schools? We've heard from politicians, emergency responders, our government. I'd like to know if any school studies have been done within the schools, asking our own students, what steps do you think would be helpful? I haven't heard anything from the students aspect yet, nationally or anything.
Good point. Now we're going to jump to the front here, and on my left, I'm going to ask Dr. Zahorchak to try to respond to that challenging question of firearms and children and in the school environment.
Yeah, I think one of the things we do every other year with the Pennsylvania the Commission on Crime and Delinquency, every other year the PCCD does the state, county, and very local school districts youth survey. That youth survey gives you a ton of really rich data and also connects it with potential resources for schools, but it's only the student voice that you hear, and we hear it every 2 years loud and well. And the most recent one, just like your study, Doctor, hot off the press, is very, very telling about Cambria County and the local school districts in terms of what's going on in the community, because there seems to be some really good pro-social strengths from inside buildings when kids go there to teach moral behavior, to teach pro-social development. But as soon as you leave, and lots of times all summer long, our kids are telling us the communities are dysfunctional, not aligned, not enough for them to connect to, and also maybe contributing, not all, maybe, they're telling us that there's a contribution to antisocial behavior, immoral behavior, et cetera, going on outside. So I think we have to ask the question, where's the community panelists? How are we aligning community things to that? I also have a question, may I? Sure, please. I'm wondering, especially from the two gentlemen, and I really appreciate your being here. This was an extraordinarily good event for me. I'm wondering if what you think about our country's policies on all of this, especially when it comes down to the preventative kind of things, more policemen on the street, more mental health workers, better training for educators in the area of social and emotional and human development, more of that and less emphasis on how do we put people to wrong and then incarcerate them. My data may be completely wrong, but I think we have 6% of the world's population and 25% of the world's prisoners. Bloomberg has done something, and that city has done something quite different. And I'm wondering where you land on that policy decision-making position.
Doc, like I said before, I'm a firm believer in prevention, but as we all know, some of us are administrators, and using Johnstown example, one time Johnstown had 50 police officers. They're down to 36 now. As you lose people, you end up becoming more reactive to the thing. All you can do is answer the calls and keep the status quo of trying to keep people safe. When you have the extra manpower, that allows you to go out and, like I said, be proactive. Put people out there to stop this type of crime. Handle that type. So in that respect, more does help to tend to reduce the crime. You're preventing it before it does happen. In the same way I look at it with the school. If we can get that collaborative effort with our mental health people, getting help to these kids before they act out or before there is a violent act, I think it will make our job so much easier and better be able to allocate our resources more. I commend Johnstown, and I've looked at theirs and with Mike with the school resource program that they've had. And I think a lot of people get the misconception that that police officer is nothing more than an armed guard in that school. I think they have to take a more active role than just being an armed guard. They have to be a stakeholder actually within that school. And that's why it takes a very special person to be a school resource officer. And Does that answer your question at all?
It goes into, I think I'm looking at bigger, what are the policy levers that we could advocate for and maybe collectively start to say the community needs help and need feet on the street as opposed to people passing by.
The big getting back would probably be the funding to help fund a lot of these programs. Everybody's running pretty much bare bones budgets anymore, and we need help if we're going to try to prevent some of this. And I think that is legislatively, that's one of the areas that local municipalities need to help, along with some guidance.
I'd like to say, though, that one of the nice things about the school resource officer program in Johnstown is that the municipality and the school district stepped up together and shared the cost. And I'll also add on to what Chief Bergen said. Every one of our school resource officers, you know, too, things get a little sticky sometimes in that arena. It was always a joint effort where we sat down and said, let's make sure, like you pointed out, Chief, we put the right person in there. And what we found when we put Officer Miller in there, and if I go back from our first school resource officer, they have become a presence that the students feel comfortable with them, not as a police officer, but now you can't believe the number of times that students would come to those police officers and tip them as to incidences that were likely to occur. So that presence is awesome because you're going beyond just that role of a police officer and becoming more even an advocate in the school district and in the shared costs. So that was important to us.
And I'm going to go a little rogue here for 1 minute. I'm going to introduce a school resource officer who is here from Johnstown because I heard him speak at the event that Ron Springer hosted a few weeks ago, and he spoke about the role of the resource officer in the school in a way that really got it to me, about making connections with students and families in the community, because I think that's really the key that you said, putting the right person in there. So can I put you on the spot for a minute and introduce you?
Hello, everybody. First, I'd like to thank this panel. This is a great panel of diverse people in the community, which is what we're trying to look for. And for you guys being here to educate yourselves on what they have to say. Just to talk a little bit about the school resource program and what it is. It's not like they're saying just taking a police officer and putting them in the school. That's not what you're looking for. I want to try to get out to break some ideas of what people have about the school officer in the school. We're not there for the active shooter. We're not there for the school presence and the person with the gun to arrest kids for fighting and drugs. That's the smallest part of our job. To give a little background on me, and me being in the school, I've graduated from St. Francis University. I was in the military. I'm a member of the entry team on the SWAT team. I'm a crisis intervention officer, which works with mental health and de-escalating situations. When I'm in the school, we take all of those aspects, from being on a SWAT team, working with mental health, being in the academic system with the college degree and everything, that you use all of those to help the kids, to bring the community forward. And the school is the beacon in the community. But when the school doesn't work with the community, or the community doesn't work with the school, you're missing out there, and you're losing that I don't know, what you need. You need the connections here. You need everybody to work together. Like they've said, like they've reiterated, the school is a safe place for kids. It's where they have a meal, they have lights, they have heat, they have safety. You need to expand that out into the community. You need to be there for them. As a school resource officer and being trained as a school resource officer, we work on a triad system where we're an educator, mentor, we're a counselor, and we're in law enforcement. And like I said, the law enforcement part is the smallest part of that. We need to be integrated. Your officers need to be integrated into the school system. They need to take part of the school. They need to be at the activities. They need to be there for the kids. And those kids then talk to their parents. And the parents then talk to us. You know, they'll come to us. Oh, I get calls from parents all the time. My kid's having a problem. Can you help them with this? Can you help them with that? Absolutely. That's what we're there for. I do most of my day is informal counseling and student assistance, parent assistance. So that's what we're looking for when we want school resource officers. We don't just want the guy in there that's going to stand there and look at everybody and you better behave. You know, that's not what we're there for. We're there to integrate into the school. We're there to educate the kids. We're there to be mentors. We're there to break the barriers. We wear the uniforms so that they see an officer in uniform, they build a trust situation, so when they deal with officers outside of school, they can talk to them. They see us and not just the guy that came in and arrested their mom or their dad the night before. Do you have any questions for me? Okay.
We have a superintendent in the back there, and then one other question to follow. Please, Susan.
First of all, I appreciate the coordination of this panel, very much so. We are appreciative of the coordination of the emergency response personnel. We've worked very successfully with folks from the Windber Research Institute, formerly Office of Community Health, in bullying prevention. We believe in bringing mental health initiatives into the school. I appreciate all of that. The question that we're receiving quite frequently now is building infrastructure, you know, your facilities. What are you doing to change your facilities? And I don't know whether there's any unity in that response, or whether, again, we refer back to the local response teams individually. It's a difficult question to try to answer.
Anyone have a comment on that as we attempt to uplift what we have in our very old buildings now, or in our attempt to redesign new buildings that may be going up? What can we do?
Like you had said before, we had that, or I said before, we had that shooter at our building. It brought out a lot of security faults within the police department. Our building was built in the mid-1980s. Nobody had in the thought plan in the 80s anybody was ever going to attack a police station. That was always like a safe haven. Afterwards, I ended up getting in contact with a friend of mine from the state police. The Pennsylvania State Police has a unit, they call it their hard hat team, that goes out and looks at the physical security of buildings. And they actually came in and looked at the physical security of our building. One thing he also mentioned was they also do schools. They'll come in, they'll look at a school and give a report of recommendations that you can do to build the school, to harden the school, you know, security systems, whatever it may be. But they work with you on that. They walk through with you on it. They look at your school. They take into account the age, because a lot of our buildings are older. Our building was considered to be a newer building compared to some police departments, and it was woefully lacking. One thing I didn't elaborate before was where the windows and everything we have in our building, we never thought of a problem, no problems that day. Our air conditioning plant was down, we had a window open, and we know from it came out of preliminary hearing, our suspect videotaped himself. He looked at a window, then looked at a car and decided to shoot the car first. Had he gone for the window first, there were 2 officers sitting there doing reports at that time, and the outcome might have been a little bit different. That made us have to look at that part. And that's why we had to have an expert come in to look at that security. But it was a free service offered by the state police, if that might help in answer some of that.
Sharon, you had a question in the back.
I don't know if mine is so much a question as, and forgive me, I hope I hold this together. Mine is not so much a question as it is just to comment on today's meeting and what this is all about. 15 weeks ago, I lost my 15-year-old granddaughter to suicide. She hung herself. 20 minutes prior to that, she had called me at work. I was in the conference room and don't normally answer my cell phone when I have a conference going on, and something made me answer my phone that day, and I'm so grateful. She called to tell me she loved me and to ask me if I was coming over for the weekend. And we had some other pleasantries, and of course I got to tell her I loved her. And then 20 minutes later, I got another telephone call from my daughter. I know all of you have family and children, and you understand the pain. But my comment today is the comment about her death spanned over 8 school districts. We had over 850 youth that have visited, that came, that set up vigils. It has spanned the 15 weeks and will continue. Along with that, I want to say school superintendents, teachers, people within the schools were excellent, but I do have to say there were some holes, I think, that are missing that I just want to reiterate for all of the teachers here. My daughter lives in Clymer and had an illness, and my granddaughter came to live with me and had returned home in September, and then this had happened in October. I myself probably receive in a month, every 4 weeks, I probably get about 5 phone calls from youth calling my house and leaving me messages on my answering machine. And it doesn't sound bad, but when you're only 12 or 13 years old, to be calling your little friend's grandmother that you don't really know, but you have the contact information. And today, I've not really heard an impact from anybody about social media. The night of my granddaughter's death, she received something like 11,000 hits on her Facebook page. You can't overlook social media, and we can't overlook these youth that are still calling, still following up, and yes, we do have something in place. I'm very grateful for crisis intervention, and I'm also grateful, as I said, to some of the superintendents that helped me with this. We now take those telephone calls and turn them over, and then the schools are able, by pulling the files, to find out, because I don't know these youth. I wish I did, but I don't know all of them. But they're still calling, and they're still grieving, and they don't know what to do. And I think that's something in our schools, too, that we need to do. Is somebody, the gentleman here just made the comment, I know when I go over to Clymer, because that's where my daughter's from, and I see the kids, they all run up to me, and it's, oh, it's Dessa's grandma, it's Dessa's grandma. But it never fails. The moment you're standing there, you get a child who immediately tears up, and it just tears your heart out, because you know how hard it is for them. But I also think with all of this, we need to reach out to our children in school, and we can't be afraid to talk about it, because that's something I found out with the kids. To talk about it really helps them. And I realize in school we set up a counselor, and they can go to that room and talk to somebody, but we all know how our kids are. They're embarrassed. They don't want to reach out. They don't want people to think there's something wrong. But yet I keep getting the phone calls. I have one little boy that calls me, probably calls me once a week, and he cries when he calls to tell me how much he misses her. And it tears my heart out to think that these children are all grieving yet. And I know after my granddaughter's death, no more than 3 days later, there was a death 20 miles away from her home of another 16-year-old that had taken her life. And I can't help but wonder, did my granddaughter's death have something to do with that child? Because you never know how our youth look at this. But I just wanted to make that statement, but I did want to say I'm so grateful to the school administrators, to the teachers. My granddaughter went to Conemaugh Township School. When she came here, we transferred her to Conemaugh Township. And I can tell you, Conemaugh Township has been incredible to work with and follow up. I'm very grateful to them. But again, do not overlook, whenever you're doing any type of services, do not overlook the social media and the impact that it has for youth. They use this social media to umpteenth powers. You talk from everything from bullying to pouring out their hearts to watching what they're saying. You almost can see the tide. And I just think it's important. But I just wanted to make a comment that I think this is great today. And from someone who has walked a really hard path, I'm just grateful to know that this is going on. And Matt, thank you.
I think that would be a very appropriate point where we could end this discussion period, and to use Sharon's words, let's close these holes that we have. We don't necessarily need our legislators to take upon the responsibility themselves. We don't necessarily need a significant large amount of money to fix things here. We have incredible level of expertise in the audience and sitting on this panel. So we are, dedicated here at the Windber Research Institute and with our fellow stakeholders to continue this process in a very deliberate, research-oriented manner. For those of you who don't know, we in Cambria County have more youth data than any other county in Pennsylvania. We have 12 years of Pennsylvania youth survey data that allows us as a county and individual school systems to look at our children, and we're going to have an upcoming session on that. It's important to talk about post-traumatic stress disorder. We will have an upcoming session about that, and we will have a more deliberate session on bullying prevention, a longer session on bullying prevention and violence prevention from the experts in the area. So we hope we get that message out and make it known to all of you folks and to our legislators and politicians that together we could close these holes. So thank you very much for being here today. I'm sure the panelists will be available to you all, and thanks for looking so good out there as we streamline you all to the internet and beyond. Who knows where it's going to go? Thank you all very much.